According to United Nations Children's Fund, UNICEF, the new global maternal mortality report shows that 82,000 women in Nigeria die from pregnancy and childbirth-related complications every year, while the country's maternal mortality rate remains 512 deaths per 100,000 live births, which is nowhere near the SDG's target of 70 per 100,000 live births by 2030. There is also a high density of unaccounted maternal deaths, some of which occur in the home of traditional birth attendants. In Ebonyi State, postpartum hemorrhage, which is one of the common complications from traditional birth attendants, contributed 36% of recorded maternal deaths in 2022. Some of the reasons for these deaths are rooted in poverty, inequality, religious, cultural, and poor knowledge. Mrs. Virginia Ekoma, a nursing mother who delivered her twins in the house of a traditional birth attendant on June 21, 2023, just like other pregnant women, narrated her ordeal of bleeding before and after the delivery of her set of twins, which left her unconscious without the intervention of the TBA, who lacked the necessary skills in handling complications. Before I went into labor, I started bleeding from the house, and after considering how I can raise money to go to the hospital, I told God that I would not go to the hospital. Then I went to the traditional birth attendant's house. But after giving birth there, the bleeding started again until I returned home. I was unconscious till around 2 o'clock before I regained consciousness after a patent medicine dealer gave me some drip.
I delivered my first child at a traditional birth attendant's house. What I was not comfortable with was the environment. But it's just a compound where you have other tenants living, and it's just a little room, you know, with a bed. And I'm coming to a federal medical center because I think it's just okay to be where I have people that can take care of me very well. Like in my other pregnancy, the second one, I think I had little complications, which if it was not in a hospital, I didn't think a midwife or, you know, just, could be able to handle.
Since I started delivering, I no go any hospital. But during the time that I go to antenatal, I go in there. But the day that I delivered it by myself at home.
These are just few out of many complications that sometimes lead to the death of both pregnant women and their children, which in some cases are covered by TBAs. According to data from the Obstetrics and Gynecology O&G Emergency Alex Ekwueme Federal University Teaching Hospital, Abakaliki, the statistics of unbooked patients referred to the hospital from TBAs where they were unable to handle complications between 2021 and middle of July 2023 is 128 patients. This reveals that nearby health facilities often bear the brunt of cases of complications from traditional birth attendants.
A whole lot of complicated cases are being referred from the traditional birth attendants. You know, when you talk about birth, there are so many factors that affect the birth of a baby, either positively or negatively. Some factors are maternal based, some are from the baby. For instance, a woman that is married to maybe somebody huge, or the genes of, you know, very big people runs in their family, and then she herself is of a very small stature, and then the baby is very big, and they don't know, they will go to the traditional birth attendants to deliver, not knowing that the passage, that is her own cavity, cannot contain that baby, you know, allowance, cannot give allowance for the baby to come out. In medical, the midwifery terms, we call it cephalopelvic disproportion. That is, the size of the baby is not commensurate with the cavity. So that makes the birth very difficult. But when they go to the traditional birth attendant, because they are not medically trained, they don't have the skills, they don't have adequate knowledge, they wouldn't know. And the woman will be there laboring until sometimes we have the womb ruptured and the baby falls in the peritoneal cavity, posing danger and life-threatening, in short. Then sometimes the labor will become obstructed and then the baby gets stuck in there. Sometimes a hand will come out, sometimes a foot will come out, and before they are rushed to our facility here, that life is already gone.
The problem we're having here is much of what the traditional birth attendant will normally do with our patients outside there. Before they have brought the patient here, the patient will be bad, and we're not happy with them. At times, we normally educate our patients that whenever you went there, like Mr. High Health Center, and they know that this condition, you're not going to be able to treat it, let them refer it to us. But ideally, the things we normally see there is not encouraging, because at times when they brought the patient here, the patient will even die in the vehicle on the way coming. And they have brought it in the front of A&G emergency. The MVA. When incomplete miscarriage, we have the register. Okay. And most of them that is coming from traditional birth attendants, they normally fall in this category. Okay. Because at times when they go there, the people who are there that are managing them, they say that they are doctors or nurses. They are not doctors or nurses, they are traditional birth attendants. Before they are going to rush the patient here, it should be incomplete abortion or inevitable abortion. We carry out our procedure. You understand? Some of them fall inside here from the village, rushing them here.
We have been having series of them, the cases of the people that will go to TBA instead of them to come to a health center where the people working here are trained, are qualified. We have nurse midwife, we have nurses, we have CHUs trained, and BMOC, all of them are trained to render that service of delivery. But they will go there. When they go there, when they will come here is when the condition is already bad. Their service will swallow. When you check the fetal heart rate of the baby, you might not hear the fetal heart rate of the baby. That's to say that they have stayed there for 3-4 days. The baby in the womb has died. So we see a lot of them every day, unbooked patients. When they come, we'll ask them. They will be trying to cover. They will say, "Is not one thing with the clients or those women is that they don't tell you the truth, but we used to paint them so that we'll get, because when you don't know what has happened, you don't know where to intervene. So that's how we have been doing it. But thank God, when they come, we have a visiting doctor here. At times it will lead to surgery. At times it will be the one we do ourselves. At the end, it will lead to a successful story. But majority of them lose their babies.
Ebonyi State Coordinator, Reproductive Health and Safe Motherhood said that no traditional birth attendant has been prosecuted in the state so far, but speaks on various laws and efforts of the state government to arrest a traditional birth attendant who is now at large in Ebonyi Council area for the death of 2 women who came to deliver their babies in her house.
The traditional birth attendants is not only in Ebonyi State that they are causing so much havoc. In the past, we have tried to, regulate them through a law, the MCCI law, but to no avail. They still continue to do what they do, and they are there causing so much havoc because there is no way you can compare somebody who is skilled to somebody who is not skilled. Well, thank God our government, the present government, has health as one of the priority areas. And we are going to, bring them out once again to tell them their limits. Because you see a woman, like the one that we visited sometime just last month, when we heard what she did. We went there, though on sighting us, she ran away. They hid the woman in one of the rooms. So the husband came out, because the report that we got was that this woman delivered a woman, somebody, and then kept that woman in her home. The placenta did not, come out, did not deliver the placenta. It had retained placenta, which if she was to be trained, she would have known what to do. But she kept this woman in her home for 5 days, telling the person that placenta gradually it will come out. And that woman died of infection. Another one that we got from the same woman was as a result of a woman was bleeding, postpartum hemorrhage. She kept the woman. Finally, the woman died. So when we got there, when they sighted us, they ran away. She ran away, but we are still on that matter, because we told the man and even the father, we invited them to the state, because though MPDSL is all about no blame, no name, no blame, we just want to correct her that this thing you're doing is not good, so that she will know her limits and then stop it. In exactly 16th December 2020, the former Excellency Dave Umahi signed into law our maternal perinatal death surveillance and response law. He signed it, it's gazetted, we have a copy. And this law, stipulates, says it all, that if a death is not a punitive law, so to speak, that when in the course of managing a patient and the patient, you did everything that you're supposed to do and the patient dies, nobody is going to blame you. But where it will be an offense, even to you as a health worker, that you have death and you refuse to report that death. Because in reporting that death, we'll be able to review what is it that happened. Is there anything that the government, is there anything that the community, is there anything that even you as an individual should have done that would have prevented this death? That's the essence of this review. And then we'll recommend, and the action is taken. If it is as a result of no access road, maybe the woman was in labor and there was no access road for that woman to come to a health facility, it will be documented, and then the government will take it up, either from the local government or the state government. If it is something that is so, maybe flawed or whatever, that the federal government should come and help, we also make it known that this is as a result of this that you did not do. So everybody has his own way of intervening. So in that kind of a thing, that law is operational because it is there since 2020. And this saying that, if you're ignorant of a law, it does not give you, you are not exempted. So that law is there. If you, even at the community, because we have the community, the committee at the community, of which the TBAs are also part of that committee. If you fail to report any death that happens in your community, you are liable into some of the, the punishment. You see some of them getting up to 3 months imprisonment, getting up to 6 months imprisonment, getting up to, paying up to 100,000 naira, and even both will be given to you.
Despite the glaring dangers and implications of using traditional birth attendants during childbirth, a reasonable number of rural women in Ebonyi State still patronize them, giving high cost of hospital bills as one of their reasons. No, I have never been to any hospital for childbirth before. There is one woman in this village, anytime I went into labor, she would be called. Even when my baby died in the womb, the woman also helped me to deliver that baby. There is need for orthodox and traditional medicine to coexist because some of these villagers are not mobile. They don't even have motorcycle, especially when labor starts in the midnight. Before they will find means of transportation, the TBA that is close by will be called to help out.
Before a pregnant woman will be rushed to the hospital, it took up to 5 hours, 6 hours. And even transportation is a very big problem. But when the bed attendants, these traditional bed attendants are very close, the woman will be rushed there and will be attended to quickly and they will deliver safely. So I'm appealing to the government at least to assist these traditional bed attendants, give them training so that they will be equivalent to those trained nurses.
Most of these traditional birth attendants lack the requisite skills, structures, and equipment for handling childbirth. That is why they use huts situated in their yam barns and kitchen line rooms as their facility. Some of the TBAs interviewed by NTA News denied ever encountering complications in their many years of practice and called for support and training from relevant authorities to enable them function better. If you come to my house and you are pregnant, there is a herb I will pluck from the bush and give to you, and you will deliver your baby. If anyone is bleeding, I will also go to the bush, get some herbs and give to the person. That bleeding will stop, and I will tell the person to go to the hospital. When my mother-in-law was still alive, whenever she was performing female circumcision, she would call me to watch. When she became old, if they brought people for circumcision, I will be the one to handle it. But now, if a child is born and it is a female child, like my son's wife that gave birth to a female child, I used Vaseline to press down her clitoris instead of cutting it. What I want the government to do is this. Since a health center is close to my house, any day labor becomes difficult there and there is no doctor around, I can go there and help out. After that, the government can give me whatever they deem fit. I am currently at Isheke in Ebonyi local government area of Ebonyi State to interact with this woman here. This woman is a traditional birth attendant residing here, and she started conducting deliveries for pregnant women since she was a child when she learnt it at Akbugo in Enugu State when she was about 9 years old after her primary school days. And this is the hut where she conducts deliveries. She said she lost the key and she's looking for how to gain entrance again. As you can see, this is just like a kitchen line. I started practicing. I have never had any problem or complication cases that led to any loss. When you come, you will just enter that way and give birth to your baby and go home. I can tell you that almost all the children in this village were delivered in my house. Just that nowadays, hospitals and health centers seem to be everywhere, and I don't get many pregnant women coming to give birth in my house again. But if it comes to childbirth, most people that still come here to my house are those that go into labor at odd hours of the night when they cannot go to the hospital, and after giving birth, they carry their children and go home. If I look at you and see that I cannot handle delivery for you, I will ask you to go so. But if my spirit doesn't allow me, I will tell the person to go. I used to get some herbs from the bush there, which I prepare and give to pregnant women. Those herbs induce and hasten labor. Before, I was charging between 1,000 to 3,000 naira for each delivery, but now my delivery rate is 5,000 naira. In spite of the influx of rural women in TBA's homes for childbirth, the available data of women visiting the Alex Ekwueme Federal University Teaching Hospital, Abakaliki, for delivery in a month ranges from 300 to 400 women, while the hospital's new delivery rate is between 10,000 to 18,000 naira for normal delivery and 70,000 to 100,000 naira for delivery through cesarean section. as against the old delivery rates, which was between 35,000 to 40,000 naira for normal delivery and between 150,000 to 200,000 naira for cesarean section, respectively. The traditional ruler of Nkaleke Kyarunuho Autonomous Community, Eze Sunday Oketa, speaks on efforts by his cabinet in sensitizing women of his community on the need to visit hospitals during pregnancy and harped on the need for government to provide more hospitals in rural areas.
I have so many people that are well educated, who educated people. Those people are my cabinets. And whenever we have a cabinet, we discuss the issue of that. To let our women go to hospital once you are pregnant. And also, we have made a law that guides my community that no one should maltreat a woman. No one that will likely maltreating his wife. Whenever we heard of that, you have a punishment. Then we need the government to have more hospitals very close, mostly in rural areas. What case women dream of delivering is lack of no hospital, lack of no health center. If there are so many health centers in rural areas, it will assist also help so that women will not die in delivery. And sometimes what kills our women is because of bad roads, which there's a place that you cannot get a road to come out. Whenever you get a call, you cannot go there with movable like a vehicle or machine because no road.
Based on the foregoing, it is pertinent for the state government to have a database and statistics of TBAs operating in the state, as well as create a traditional medicine board that will oversee the regulation of TBAs in order to ensure prompt referral of patients as a way of reducing maternal and child mortality to the barest minimum. In Abakaliki, Fortunate Ozo, NTA News. This report was supported by the Wole Soyinka Center for Investigative Journalism, WSCIJ, under its Report Women, Female Reporters Leadership Program, FRLP, Champion Building Edition.